Well, before we talk about the problems that can arise with backpacks, let's talk about the pediatric or adolescent spine. Essentially, your child's spine looks just like yours, except on a smaller scale. And of course, it's still developing. The spine has 33 vertebrae or bones, and in between each of those vertebrae, you have discs or shock absorbers. Think of them as like little jelly donuts in between all of the bones. And the spine, proper alignment of the spine, we want to have it nice and straight from the front, and you'll have 4 natural curves in the spine. A cervical curve, a thoracic curve, a lumbar curve, and a sacral curve. Those 4 natural curves in the spine, they're very, very important because along with the disc or the shock absorbers, they also act as the shock absorption for the spine. So when you have a curve in the let's say the neck, if you have a natural curve in there, you have some give. When you take that curve out of the spine, that's when you get into trouble because you lose that natural shock absorption of the curve. That can lead to undue stress on the spine, undue stress on the muscles, and especially undue stress on the discs. So now that we understand the spine and what it's supposed to look like, let's talk about the problems that can arise with backpacks. And really the big problem that comes up is when you place undue stress on the spine, especially with a heavy backpack, you can cause the child to have to compensate for that weight. And the normal alignment of the spine can be lost, as well as other problems.
When I first started middle school, I had lots of textbooks in my backpack and lots of books, which was lugging this extra weight on my back and making my back crunch over, and it didn't feel nice. And from that experience, I got lots of headaches, and I had a hard time, like keeping my back straight because I was so used to cramping it over.
When we talk about the problems that can arise, there's really 2 different types. On one side, you have what's called a macro trauma, or a big traumatic event that can happen. These are things like a child hitting another child with an overpacked backpack, tripping over an overpacked backpack on the ground, having one fall on top of your child, or even a condition called Rucksack Palsy, which is a condition where the heavy stress is placed on the shoulder, can put pressure down on a bundle of nerves and blood vessels right here in the shoulder, which can cause numbness in the hands and extremities, or even in extreme cases, permanent nerve damage. Now, you also have microtrauma. Microtrauma are little repetitive stresses that you're placing on the spine, which over time can accumulate and cause a number of problems. The number one problem that we see is poor posture. Right? And again, poor posture is just a change from that normal alignment of the spine that I just talked about. The spine should be nice and straight from the front, and it should have those 4 curves in it from the side. The most common change in posture that we see, especially with backpack use, is forward head posture. That's when the head starts to extend out in front of the body, which is really common when you have a heavy pack on your back. The body is forced to kind of lean forward a little bit to compensate for that weight on the back. Forward head posture can lead to muscle imbalances and uneven stress on the spine. If that is left there long enough, you can have shoulder, neck, or even low back pain start to show up in children, which is never normal, not only not in an adult, but especially not in a child. And if that shoulder, neck, or low back pain is left there long enough, you can have permanent stress on the nerves of the spine, which can lead to all kinds of additional problems. One of those being arthritis in the joints, or even bodily dysfunction wherever those nerves are going. So let's talk about backpack statistics for our kids. More than 40 million students carry backpacks every single day. More than half of the children in a study regularly carried more than the recommended 15% of their body weight in their school backpacks. You never want to have more than 15% of your child's body weight in the pack at one time. So let's say that your child weighs 100 pounds, you don't want more than 15 pounds in the pack. Another study found that 58% of orthopedists polled in a 1999 study in Chicago and Wilmington, Delaware, reported treating children with back or shoulder pain attributable to carrying backpacks. 58%, that's a pretty high number. The most common symptom reported from backpack use is rucksack palsy. This condition results when pressure put on the nerve in the shoulder causes numbness in the hands, muscle wasting, and in extreme cases, nerve damage. So what should you be looking for when you buy a backpack for your child? Let's go over the American Academy of Pediatrics, what they recommend. So the things that you should look for are, 1, a lightweight pack. Traditional canvas is best. You want to stay away from leather or other heavy materials because it just adds weight to the pack. You want to look for 2 wide, adjustable, and padded shoulder straps. Narrow straps can dig into the shoulders and cause stress on those nerves that are in the shoulders. You want to make sure that the back on the backpack is padded. This increases comfort and protects your child's back from sharp objects inside the pack. A waist belt is very, very important. This will help distribute the weight of the pack evenly across the body. And another thing that will help distribute the weight are multiple compartments, because your child can distribute the heavier objects throughout the pack and not just have them in one area.
Certain backpacks don't have the right support for your back. Even though they might have nice cartoons and pictures on them, they might not be the right one for you. And it's better to get the ugly backpack that supports you than get the pretty one that might injure you.
Now that we know what pack you should be buying, let's talk about how to teach your child how to use it properly. Number 1, lighten the load. Limit the backpack's weight. No more than 15% of the child's body weight in there. We already discussed this one. Number 2, teach your child how to properly lift the pack. Many children just kind of pick it up off the ground and sling it over one shoulder. It's definitely not the right way to go. So here we see Kenya carrying the pack incorrectly. She has it slung over one shoulder, which, as you can see, causes the left shoulder to shift out to the left and the right hip to shift out to the right. Remember when we talked about proper alignment of the spine, we want to see everything nice and straight when we look at it from the front. You want to teach your child to bend at the knees, reach down, pull the pack up close to their chest, and then bring it over one shoulder and then put the other arm through, making sure that the weight is evenly distributed. Number 3, use both shoulder straps. Again, many children think it looks cool just to kind of throw it over one shoulder, but that'll throw the center of gravity off and cause a child to lean to one side. With Kenya's left shoulder shifted out to the left and her right hip shifted out to the right, this causes an unnatural curve in the spine, which, if you think about it, one side of the spine is going to have too much weight on it and the other side of the spine is not going to have enough. This over time can cause increased wear and tear on the spine. Now we see Kenya wearing it correctly with both straps on, and as you can see, the shoulders are nice and level and the hips are nice and level as well. This is important for keeping proper alignment of the spine. So the next 2 things that you want to look for is you want to make sure that you tighten the straps of the pack enough for the backpack to fit snug but not too tight. You want to look for a space. If there's a space in between the pack and your child's back, that's an indication that the pack isn't tight enough. Here we see Kenya from the side, and as you can notice, there's a space in between her body and the pack is riding really, really low on her buttocks. What this does is it forces her to shift forward at the hips and causes more of the forward head posture that we've talked about. Over time, if she continues to do this, her spine will actually misalign into this position because, I'm always telling my patients, whatever position you hold, over time your spine will naturally gravitate toward this position or bad position. So what you'll do is you'll pull up on one side of the strap and then gently pull down and tighten the strap on one side and then repeat on the other side. Also, you'll look for how high or low the pack is riding on your child's back. You want to make sure that it's riding about an inch or 2 above the hips. Now we see the pack properly worn. You can see there's no space in between her body and the pack is riding up above her buttocks. What this allows is for her to straighten her body up and it brings her head back over her shoulders where she's supposed to be aligned. Number 4, you want to tighten the straps enough for the backpack to fit snug but not too tight. Many children have it kind of hanging down, way down low. You want to make sure that you tighten the straps so that they're nice and snug, but you don't want them obviously cutting off the circulation in the shoulders. Here you can see Kenya with the straps too loose, and what you'll notice is the straps are too far out on her shoulders. This puts a lot of stress on her shoulders, especially as they're developing. what you want to do is tighten those straps and bring the straps in closer to her neck, but not right next to her neck, right in between the outer portion of her shoulder and her neck. Kind of split the difference, and that's the ideal place to have the strap. And now that Kenya is wearing the pack properly, you can see that her shoulders are nice and level, her hips are nice and level. This means that the weight of the pack and her body is evenly distributed over her spine. This is going to allow for longer, healthy, and vibrant life in her spine.
The decisions you make now might affect you when you're older. So if you choose to lug around your backpack with one strap on and not really care, you might have you might have back problems when you're older.
So if you feel like you need more help with the spinal health of your child, you can look on my website under the Health Resources section, or you can go to www.kidshealth.org. Or if you have a specific question for me, you can always email me, drjohn@drjohn.com.